Thank you very much. You see, last time my take on this is this: non-compliance. The question you have to ask yourself is why. The highest instinct in man is the instinct of self-preservation. So why are people not complying with protocols that will help them stay alive and well? Ask that question until you find answers to why people are not complying. You will never be able to get them to comply. Secondly, our numbers are rising. I listened with an analytical mind to the SGF yesterday, and he said something that I think we must take to every ear. Thank God the NOA man is here. You have to take it to every ear. What is it? In the last 10 days, we have had not less than a case finding of 500 confirmed cases daily. And for each of that 500, one out of that 500, you have 5 other persons out there in the community who have not submitted for testing. And so if you put statistical tool into these figures, that will mean you will multiply each 500 cases we have had per day by 5. And it simply means that what we're supposed to have dictated for that day is 2,500. And that has been very consistent in the last 10 days. It's worrisome. Now, the managers of the PTF pandemic intervention, they have also not been able to situate succinctly the factors driving this spike. If you are not able to establish the factors driving the spike, you will not be able to bring the spike down. In Brazil, they opened school. They put all measures for safety in place. However, children, pupils, and students were coming down with infection. And when they analyzed, they discovered it was not. It was a compromise on the food source, on the restaurant axis, on the feeding source. That is how to intervene in a public health emergency. 2 questions unanswered, even with this ease lockdown. They are, what are the factors promoting non-compliance? What are the factors driving the community transmission? It has to be answered and effectively communicated. Why we got to where we are today is because of ineffectual risk communication. I will give it to the PTF COVID. It's only one of the things they've been able to identify going forward. And they had said that part of what they intend to do with these 4 weeks is to establish community level structures that will drive this risk communication. I hope that gets to happen. Do you know why I'm putting that out? Now, the other day we had a pilot trial of how aircraft will move from Lagos to Abuja and vice versa. Have we had a pilot evaluation of how all the private motor parks, the public motor park Jabi, will operate going forward from here to Lokoja, and from here to Lagos, and from here to Enugu? It's not been done. You have just read out the normal universal thing you want them to do. Let me tell you, what was promoting the violation of interstate travel? All the private companies, do you know what they did? Cleaned off the markings on their vehicle. And so when you go there, they tell you we're not loading. If you go there, they're not operating. But vehicles leave their beat every day of marked vehicles. And that was what fueled that. I expect the PTF COVID to rejuvenate their technical arm. I have said on this platform, the absence of medical laboratory scientists to give sound medical laboratory advice to the PTF on the technical arm is part of why we're having issues, including with testing.
Dr. Casmir, you are raising